Dr. Lindsay Taylor with another code to share with you today that I often see misused when I'm writing my peer reviews and independent medical reviews reports. Today's misused code is 97164, which is officially a reevaluation of physical therapy established plan of care used by physical therapists. Now, technically in the CPT code book, if you read it, it says physician or other qualified healthcare practitioner. So certainly chiropractors can use this code, but I would say you should really use regular E&M codes 99212, 99213 if you're doing re-exams. But what I see is that people are using this code just when they give a patient a disability index. So I think there's some confusion here, and I'd like to kind of clear that up. So this is straight from CPT code book, okay, where this is coming from. And it says, the reevaluation of physical therapy established plan of care requires these components: an examination, including a review of history and use of standardized tests and measures is required, and a revised plan of care using a standardized patient assessment instrument and or measurable assessment of functional outcome. So what does this mean? It means that first of all, you have to do an examination, and what I'm seeing are no exams taking place whatsoever. The documents will show that they did a neck disability index or an oswestry, a revised oswestry disability index form, and that is it. And that is not an appropriate use of this code. It will get denied every single time. Because you're not doing what the code requires. The code requires a review of the history, so you have to kind of check in with the patient. What are their symptoms today? What are their pain levels? What's the quality of their pain? What makes it better? What makes it worse? You have to go through all of those things, and you have to examine them. So we're talking range of motion, orthopedic testing. If they had abnormal neuro, you have to redo those neuro tests. You have to do an actual examination on them. And you have to give them you have to do a disability index as part of your exam, but you also have to do a change in treatment plan. And that includes keeping the treatment plan as it is technically, but you have to revise the treatment plan. So if you were doing 2 visits a week for 4 weeks or 3 visits for 4 weeks as your original treatment plan, this is now saying, okay, now we're going to do 1 visit a week for 3 weeks or whatever it is. There has to be a new revised plan of care. And you have to use either the disability indexes, or it also says you can do a measurable assessment of functional outcome. So if you had the patient do a squat on the first visit and you were checking that how they functionally can perform that, redo that again and see how they've improved or not improved, right? But all of those have to be in the record for this code to be accurate. And again, this is code 97164, and I am very often seeing it lately in my reports. And like I said, these doctors are just putting it in because they gave the patient a disability index. And on top of that, let's say on Monday, they give them a neck disability index and they bill that code. And then the patient comes back in, let's say Wednesday, and they give them a low back disability and bill it again. And again, there's no examination taking place. There's no revised treatment plans taking place. It's completely inappropriate use of this code, and I will deny it every single time. It really should only be used by physical therapists, for one. Even though we can use it, we have better codes that we can use because, again, an examination is required to use this code. So if you're going to do an exam, you're better off billing 99212 or 99213 depending on the complexity or time spent. So anyway, that is my spiel for today, for today's inappropriate code of the day or of the week or of the couple of weeks. So please stop billing 97164 unless you're going to do it appropriately. And again, if you are doing it appropriately, you're better served by regular E&M codes anyway. So hope you guys have a great couple weeks.